I'd like to introduce to Hayley. She's representing the Byron Youth Council. And do you have other members there from the Byron Youth Council too? Do we have? Yep, good on you. Hello girls, how are you? Haven't got your names written down here, so I'm not sure. Dr. Melissa Kang, we just did a session. Dr. Melissa Kang is the Dolly Doctor, so congratulations. And we have Sahaj down here from Byron Youth. And Dr. Maria Pilotta Chiaroli, did I get that right? Oh, I'm quite good. I feel quite sexy. From the Deakin University of Social Diversity and Health. I'm sorry, we would do longer introductions, but I'm afraid we have got a short session. Professor Alan McKee of QUT on youth, online sex and real sex. Just having a look, but making professors young now. It's like police. Sorry, it just makes you feel like such an old fart. Peter Chown, psychologist and adolescent health consultant. And Daniel Whithouse, author of That's So Gay. Daniel? All right. I'd like to introduce you back up here, Jack. Jack is going to get the ball rolling, as it were. Shouldn't say ball rolling, should say balls and labias rolling. Want to gender neutralise it in our language and get it going.
Well.
Tracy, we're so sorry. Somehow Tracy ran. Sorry, Tracy, I didn't double space and I missed you there. Please excuse me. Tracy Randall, criminal lawyer and specialist on sex, young people in the law. Tracy, so sorry, Tracy.
As we have Dolly Doctor on the panel today, I hope you all have your Dolly magazines ready for signing. I know I do. I've brought my favourite Emma Stone edition. But moving right along with the questions now, I'm just going to briefly kick it off. So, this I address to the entire panel. Answer all at once if you want to. How much do you think adults use health messaging to try and control young people's sexuality?
So I'm lucky enough not to have any children, which means that I'm always, but I do have a mother and a father, so I'm always the child in the relationship. And so my natural sympathy is always with the person who's being told by the older person what they should do. And so when I look around and see the way that parents talk to their kids about sex, absolutely, it always looks as though it's them, particularly with young women. It always seems to be the dads trying to find a way to control where they go, who they see, and what they wear, which is not always the best way to build an open and honest relationship with your daughters.
And in that, because there's obviously really good health messaging that needs to get out there, but, how do you not use that as a fear campaign then for a young, you can't have sex, or, you'll get warts, you'll get cancer of the something, you'll get STIs, how do you give health messaging without terrifying people of ever touching anything?
Unfortunately, I'm a doctor, which means that I'm responsible. My profession is partly, if not fully, responsible for the fact that we now use safety and risk as a sort of manipulative tool almost to get young people to not have sex. And I think that is wrong. Young people and older people will always have sex, have always had sex, and should continue to have sex because it's good for you. And it's what we've shifted from is a position where it was considered morally wrong, to enjoy sex, particularly if you're a woman. And you were kind of, you had to wait till you got married to have sex. Well, some people are never going to get married, don't want to get married, and shouldn't have to get married to have sex. What we've now, so the message has changed where we're now saying, okay, well, you can't have sex because you'll catch something or you'll get pregnant or something terrible will happen to you. And that's been partly the fault of the medical profession. But I think what we need to keep telling young people and parents and doctors and health professionals is that, sex is and should be pleasurable. It's something that you discover usually even before puberty. You start to, have sexual games as children. Then you go through puberty and you start to get really intense sexual feelings. And then you enter into relationships with other young people. And part of what as adults we can inform young people is, well, there can be some physical consequences of that you might not want at this stage in your life. So this is the information that you need, and this is where you can go to get it, confidentially if you need to make sure that you don't encounter those unwanted consequences. But that's only a really small part of it. And we also know that when parents talk more openly with their children about sex, including how to protect yourself from unwanted consequences, then they're more likely to have much better, healthier, positive health and sexual outcomes. Any young person want to?
We'll move along to the next question. Sorry, just to keep it all happening. So this one, Peter, I'm directing this directly, entirely at you. How does a teacher's or adults' own personal bias influence what information or guidance we are given? So what can we do about this? Sometimes you feel like they are making stuff up, or to keep you away from sex and alcohol and drugs and whatnot. So
of course, that's our job, to make stuff up. Look, I think the thing about talking about sex or talking about alcohol, or all these sort of things, it's not a value-free zone. I mean, the reality is that society has certain values. We as individuals have certain values. The education system has certain values. I think what's most important is that whether we're a teacher, whether we're a sex educator, whether we're a counsellor, whether we're a parent, that we have some awareness about our own values. And I think what's really important is that when we're discussing these issues with young people, whether they're their own children or whether they're young people that we're educating, is that it's really, I think, important to share our values and how we got to that point. Hopefully, trying not to impose our values on the young people that we're talking to or working with. But look, I guess at the end of the day, there are some sort of, as Melissa just sort of referred to, there are some sort of underlying values I think a lot of us share, both as professionals and as parents, is the safety of young people. So it's a fine line. We've just finished running a parent session in the other room, and it's a fine line between walking that edge of how much freedom do I allow my young person, privacy is also very important, but we're also the adults in the relationship who've had particular experience, and I suppose in some ways have a greater awareness of what can go wrong. But I know as an educator working in this area for many years, just saying don't do that or this is wrong is not an effective way of getting a message across or educating young people. It's really important to have a dialogue about these things and engage the young person. If you're a parent or if you're an educator, talk about how you reached your position on this. I think the other side of this is, Jack, that I also ran a session this morning around sex online, looking at pornography. And so young people as well as adults in our society, we're being exposed to certain sort of messages around sex and ideas around sex that are not necessarily inherently wrong in themselves, but they may not be very accurate. And they can be very misleading, particularly as a teenager when you're in a stage of kind of trying to understand who you are as a person and developing a relationship with your sexuality. So for me, it's really about having an awareness around values and engaging, young people in an open discussion about that.
I just got this idea of a whole new market called accurate porn. It goes for 1 minute. It's got some rather unattractive people in it, saying things like, Daryl, Daryl, Lynn, Daryl, Jennifer, what? Sorry, there's a whole new market. See, you've got a great opportunity in your lives to go and make something happen that's going to change the lives of other people. But what about shame? I would be interested to talk about, why do you think there's still so much shame, particularly around sexual health, even now? I don't mind who answers that one. Maybe someone from the Byron Youth Service would like to jump in on that one. I'm not saying, yeah, I mean, I've had crabs. I've got to have a list of what I've had. God. But people will never tell you because everyone pretends they haven't, Everyone thought, oh, we've never had that. No, no, this is disgusting. And it's not true, is it? I'm not saying you've got crabs. Shame. Why do you think there's so much shame around things like sexual health? Do young people feel confident going to the doctor if they think there's something wrong? Or would they leave it?
I don't think I can speak for every single young person in the world, but I'm sure that some people would be. I'm sure some people would be really awkward about going to a doctor if they had something shameful.
It shouldn't be shameful, should it? And I'm sort of interested why now, because I imagine some people who work in the health profession still experience young people not presenting when they should because of issues of embarrassment or etc. Maybe throw it back to Melissa or something, or Hayley.
I'll have a say. I reckon it's a number of reasons. It's to do with your private parts, which have always, it's an area that you don't openly show to a lot of people. So to take it even into an area where it is accepted, it's still challenging for young people, and especially for young people who've never had that experience before. So just stepping into that, it's really challenging.
And also, we're young people, we get embarrassed about everything. Like, seriously, we get embarrassed about having pimples. Like...
In Holland, in the Netherlands, I saw a survey recently. 90% of teenagers in Holland, before they had sex for the first time, would ask their parents' advice. That's not something you'd get in Australia. I don't know how many of you have asked your parents' advice about how to have good sex, but it's not something that we generally talk about. So I think the shame thing is just that we're doing it wrong. We're not talking openly about sex in our culture generally, and that's just part of the problem.
Exactly why we're doing this today. Yes! Tracy, this next question. All of the questions start with I. That doesn't actually mean it's coming from me. So, is it okay for my girlfriend to send images of her breasts to me on Snapchat? This is, of course, my hypothetical girlfriend and her hypothetical breasts. So, what do you think about that?
Well, if she's under 16, it's not okay for you to receive them. It's regarded as child pornography. So you'd be possessing child pornography.
But that's a really good thing. It's just say, that was an interesting question in the fact that Jack said if I received it, like if he was sent an image like that, but it was not something that he had no control of it coming into his phone. You can't select what comes in. Do you know what I mean?
But he can select whether he keeps it or not.
Oh, yeah, of course, that bit.
Oh, sorry, I don't know about Snapchat.
Unless you screen snap it, you can only briefly...
Well, if you
Screen.
If you were watching it, it'd be regarded as an offence to view child pornography. And child pornography is a very broad definition. It doesn't just include nudity with people under the age of 16. If they're clothed and in a sexually suggestive posture, then that's regarded as child pornography.
And over the age of 16?
It's free game, I think.
Well, I'll have to have a strong word with my hypothetical girlfriend about these.
I mean, one thing I just wanted to raise about social views is the law is structured around a view that young people under the age of 16 shouldn't be having sex. And as young people, you need to grapple with that and make sure you don't leave evidence trails around about that.
Wow. And so, Tracy, How often are young people coming before the court for offences relating to, consensual relationships, and what are the implications?
Well, generally what I'm seeing is young men who are between the ages of, say, 16 and 20 who have a relationship with a younger girl. And if they're engaging in sexual activity, he's committing offences, and it's regarded really seriously, and that young man could end up on the sex offenders register, which travels around with you for 8 years and has huge implications. On the way in, I was listening to the ABC News, and it would appear that there's been an announcement today to make some changes in relation to what they call sexting laws, which I'm not quite sure what they mean yet, so that young people don't end up on the sex offenders register for that type of activity.
And is it true that if your girlfriend or boyfriend is over 16 but under 18, and then you have your 18th birthday and you engage in sexual intercourse, that can also put you on the sex offenders list?
Sorry, I missed that. Who's an 18-year-old engaging with someone over the age of 16?
But under 18.
No.
Okay.
No. 16 is the critical age, which is why a conference like this is so important for 15-year-olds, because I ran a session with young people this morning, and most people really didn't know the definition of sexual intercourse. Most people view it as...
Can you tell us what the definition of sexual... I'd like to know. I'm 46. I may not have been having it.
Well, when I say the definition, the legal definition of sexual intercourse, most young people are of the view that sexual intercourse is going all the way, penis in vagina, generally. Really, sexual intercourse is putting a body part or an object in the vagina or the anus, or putting a penis in a mouth, or putting a tongue in a vagina. That's the legal definition.
Well, I'm glad that's
Sorry to
been
be so explicit.
clearly established there. We'll move right along. Thank you, though. Thank you. No, nothing.
You don't want more?
No. After the panel's over, if we could have a sit down over a cup of coffee and you could tell me all about this. This is very... So, Alan, what about... Well, I suppose this has really been covered, but what about dick pics? What if you're over 16 and it's no longer an issue for consent? What is it? What if it's our way of normalizing our sexuality with each other?
Why are you asking me that?
Because it says Alan next to the question on the piece of paper.
I've got nothing to say about that, I'm sorry, but I'll tell you what I do want to say. So we did the focus groups with 100 14 and 15-year-olds to find out what they know about sex and how they know it. And one of the key things that came out is, particularly for a lot of young women, there was still a lot of embarrassment around masturbation. And a couple of words came up. A lot of people said that boys obviously masturbate. Everyone knows that. They talk about it all the time. It's really funny. But if girls masturbate, it is either desperate or a little bit lesbian. And I have to say to you, no. It is vital. Masturbation is a part of healthy sexual development for everybody, for girls and boys. There was an awful thing that one of the young women said in our focus group. She said, "That's not for girls to touch down there, that's for boys to touch." Oh my God. If you don't know what gets you off, how the hell are you going to be able to tell somebody else what gets you off?
That's right. And that's right. Tonight's homework is I want you to all go home tonight and masturbate for at least 20 minutes and then write a report for yourself so you can do it better to yourself next time. No, I think the problem with I was saying before, masturbation's a creepy word, isn't it? It's okay for blokes who've got really great colloquial language that normalises it, haven't they? They've got all the kind of all the slang, like choking the chicken or slapping the sausage. You girls have to come up with their own colloquial stuff, like, you know, making a smoothie or something. You've got to normalise it with your language. It's just a challenge. That's your homework too, okay?
Maybe for our next Hot Topics box draw, we can all write reflections on our masturbating, and we'll draw those out, and you can win more things. Chocolates. Maria, with so many campaigns around sexuality and so many same-sex families here in the Northern Rivers, why do you think so many kids and parents are still so homophobic?
That's huge. I hope everybody else on the panel can help me out with this one, especially Daniel and Alan and everyone. It's the stuff that Melissa was talking about. It's about baggage. It's about growing up in societies and in religions and that have always said it's bad. It's about people not being educated. It's about people not realising that in every living creature, like the lizards that are hanging around where I'm staying here in Byron Bay, there is all sorts of sexual diversity. It's not just gay and straight. It's like there's lots of stuff going on. And before Christianity and colonialism came into a lot of countries, people didn't even identify as gay and straight. They just had sex with who they liked. Has anyone ever seen any Hindu art? We would call that orgies today. You know, Hindu art has people doing all sorts of things with all sorts of other people. So it's this thing about shame, it's this thing about baggage. And can I say, I work in a lot of schools, and I find sometimes young people like yourselves are way more open to chatting about it. I start mentioning something which I think is basic 101, the clitoris, talking about orgasms and pleasure. That shouldn't just be about safety and risk, it should be about pleasure. And I start talking about the clitoris and women's pleasure, etc. And suddenly, 5 of the 8 teachers who are around the back of the room start getting really uncomfortable. So homophobia, sex phobia, all those issues are coming to us from societies that have really tried to control and repress the very diversity that's part of every living creature. You are in a position to fight it. And Daniel and I today met a lot of people in our Hot Topics, in Daniel's Hot Topic, who are out there doing amazing work. Keep doing it and keep insisting that the so-called adults in your schools and your communities are supporting you, like PASH are.
That's great. Ellen, what are the key challenges you see facing young people today, sexually in the sexual environment? The actual key one.
Me?
Well, it says Ellen.
No, I've said far too much.
We can go down there. Daniel, key.
The key challenges, I think, from my perspective, I go around to country communities and talk to lots of people about homophobia, but I get in contact with lots of students in schools in general, and what they're saying is that despite the fact that there is so much information and there's so much online and we have this idea that we must be more progressed than we were 20 years ago, that people still feel like they're not getting the information that they need. Young people say, look, we want to talk about these things more, but we talked before about messaging, and often it's about, there are these health messages, but young people say we're being told them, we're not being given the space to have conversations. We want to have these conversations and work out what it means and form that over time, rather than kind of adults, you know, telling us or yelling at us or whatever they're going to do. And so for me, it's about how we as adults and educators can let go of some of the fear and some of our own biases, which was being talked about before, to just say, hey, we can have these conversations and we don't always have to be black and white and clear and everything has to be okay.
Yeah, I just wanted to comment on that. I think, like as you were talking about, just starting this conversation and kind of addressing the stigma attached to sexual health and sexuality and everything. And I think a big part of it comes down to maybe parents who think that kids are, you know, young people are getting information from schools and teachers who they maybe think young people are getting information from the internet or their parents. So everyone kind of avoids addressing it because they think the information is coming from somewhere else. So I think it's important that every sort of aspect of a young person's life builds onto each other to support this foundation knowledge. So say if someone's getting information from the internet, that they build onto that and talk to their parents to get sort of a more, balanced, kind of well-rounded education, I guess.
Daniel, just going back to what we were talking about a few moments ago, how does using the word fag or poof or gay to pay a friend out in a social situation cause harm?
I talk to lots of students and teachers about this because it's something that comes up and people go, look, we say that's so gay but we don't mean it. Or we hear the kids saying that's so gay so we don't know whether or not we have to say something in our classrooms. And for me, and I had conversations with some of you this afternoon, and I said to you, look, if you're at school and you're hearing that's so gay and faggot and dyke all the time, do you think that that would be helpful for you? Do you think that that would make you feel supported, or do you think that that would have the opposite? And pretty much all of you said it would have the opposite. Now, even though people go, we don't really mean, when we say that's so gay, we mean it's it's lame, it's shit, or it's crap. What we do know is that when we talk to young people and we say, what would you like changed in school? So for all the gay, lesbian, bisexual, transgender, intersex kids, what would be the one thing that you would change in schools if you could? And all of them say it would be for everyone to stop saying that's so gay, for everyone to stop saying faggot and dyke. So we know that coming from them more broadly, they're saying it makes schools less welcoming for them. Now, lots of your schools had good stories to tell about young people coming out, but plenty of others, you talked about how you thought that your school was sometimes unwelcoming and hostile. And so we need to think about, it's not just about language, but obviously that's a big key.
So, Dolly Doctor, sorry, Dr. Melissa Kang, sorry. Is it all right if I call you Dolly Doctor? I'm so chuffed you're here. How do we negotiate a country town where the visitors may be confidential, but your mum's friend was in the surgery, so, yeah.
That's a really tricky one, and I've actually come up to this part of the world a few times over the last many years and met particularly doctors who are the only doctor in the town, and so they are treating everybody, and if you happen to have your appointment at the same time as your next door neighbour, I guess what you need to know is that it is your, for the young people and for parents and adults, it is absolutely your legal right to confidential healthcare. I could get sued by you if I told your parents or your teachers or even your best friend who's waiting in the waiting room anything that you've told me unless you've given me permission to. I know that that doesn't necessarily make it easier or more comfortable for you when you are in the waiting room with the next door neighbour, but you need to know that the doctor, when you go in, and in fact even the receptionist, the practice nurse, anyone else who works in that surgery must maintain confidentiality. Now, I know that might sound like an ideal world scenario. I know that sometimes that confidentiality isn't maintained, but certainly when it comes down to why you were there, so let's say it was a really sensitive topic, sexuality, mental health, drug and alcohol, just anything that's just personal and you don't want anyone to know, that cannot get shared. I mean, if your next door neighbour says to your parents, I saw your child in the doctor's surgery, you can't do anything about that. But the staff working in that surgery legally cannot. They're breaking the law if they do that.
And does that go for under 16 as well?
It goes for under 16 as well. Now, a doctor must, so someone in my position must act in the young person's best interest for safety if I'm concerned about suicide risk or if you're under 16 and you're being harmed by somebody else, being abused. By law, I have to act to protect you, but that doesn't happen just with, it just doesn't just happen, it's a process. And that should also be explained to you every time you go to a doctor if they, that there are some exceptions to confidentiality.
Thank you. I'd just like to, I'm not sure what happened to my voice there, something weird went on, finally hitting puberty. Yeah. So I'd just like to mention that even though we're due to finish at, I think, 2:30. That doesn't mean you all have to bugger off. Yeah, you can stick around and ask questions to the panel and whatnot. I'll be opening it up more to the audience. Is that correct? Yeah, Nandi Molan.
That was my nickname at school.
Oh,
Molan.
what a traumatizing childhood.
Yeah, that's why I traumatized you.
So, I'm opening this question up to the young people on the panel today. Is it important, and how do young people find someone in their lives they can talk to openly if they feel their parents are going to judge them or overreact? So opening that up to any young person.
I have so many people that I've been exposed to because I basically get into anything I can that's to do with youth and the community. So I'm on the youth council, I'm part of Byron Youth Theatre, and I'm part of PASH. So yeah, this has been a really good experience, and now I have a load more people that I can talk to about anything that I want to. So yeah, just amazing people who run these things are the type of people that you can just talk to, and I'm sure any of the adults here that you want to get in contact with, if you go up to them and talk to them, I'm sure they'll support you. And yeah.
Thank you.
Oh, yeah, something I generally tend to do is that really daggy trick they teach you in primary school where you have like 5 fingers, 5 different people that you feel really comfortable with, adults that you can talk to about different things. And generally, one of them's going to be able to help you out with like whatever issue you're having because they're all kind of, you feel comfortable with them in different ways, if that makes sense. So yeah, that's what I do.
Well, I think they covered it pretty well, but I guess, yeah, I guess it comes back to the idea it takes a village to raise a child. So I think probably everybody here will have someone who's either, I don't know, an older sibling or something, or an adult, or extended family, or just someone who's a bit older in their lives who is able to help them out with whatever it is. But yeah.
It's like pass the parcel.
I'm not quite a young person anymore, but I just want to reflect on something on that. I'm a psychologist and I see a lot of young people in my practice, and I see a lot of young people who end up feeling very isolated because of issues like this, whether it's to do with sexuality or other issues, and feel that there's no one really I can go and talk to about this. Now, I think in some cases the internet provides opportunities for having some sort of supportive connection or information around that. But the other thing I want to say, and I think it's great, the messages of the young people about finding adults or other young people, peers that you can connect with. But the other thing is that we want young people to know is that there are services out there for young people. There are people like myself and Melissa and some of the other people on the panel who spend their lives really working with young people to kind of give you that kind of support and the opportunity to talk about issues that are happening in your life. There's young people's mental health services throughout the whole of the northern region. There are GPs that you can go and talk to, doctors, and doctors can help you to also access through Medicare services like mine, a psychology service or counselling service. And perhaps also, there's obviously school counsellors, and we've got a lot of schools here today, and that's also really important to know. So I think it's really critical that you're aware that there are people out there that you can go and talk to. Sometimes it's a bit scary to take that step, but it's really great if you can encourage your friends when they're struggling to see if they can go and get help with those services. And also in Lismore, yesterday we had the opening of our first Headspace Centre. Everyone heard of Headspace? It's the National Youth Mental Health and Substance Use Support Program. So they're offering a range of services for young people, and there's going to be one opening in Tweed Head soon as well. So there are more and more what we call youth-friendly services happening out there.
If you were embarrassed, say, to talk about these issues with, another person, how reliable do you think things on the internet really are? Because I know if I think, I have anything and I go on the internet and I start looking at the symptoms oh my God, my tummy's starting to feel bad as well. Oh my gosh. I definitely have that, it's sometimes a bit of a worry. Would you agree?
Um, Before I pass it over to some other people, just the thing that I thought about when you said that is that even though there's so much on the internet, one of the great things that you can do is you can go to places like Headspace, Kids Helpline, all these other places beyond Blue, and know that the messaging and the information is fairly spot on. If you just chuck something randomly into Google and just hit the first link, can't guarantee that. So I think that going to respected kind of places like that can be helpful. The other thing is that because I deal with lots of young people who might be coming out and they don't feel they can talk to anyone in their community, is that sometimes going through that and talking to the first person is a really big step. And sometimes what they can find is that by going through places like Kids Helpline or other places, that can build up their confidence over time to feel more comfortable to talk to a health professional or a teacher or something like that. So it might be a stepping stone strategy, but always keep that in mind that there's a whole bunch of people who can help you talk about that stuff. But I think some other people had some things to say about sources and Dr. Google.
Thank you for that. No, are you sure? Is this still? There we go. So, Dr. Melissa Kang, so pleased that you could make it. How can I know this is slightly off topic of what this entire thing's about, but how can young people learn about intimacy and relationships? Everyone focuses on sex aspects, but what happens when, you get your heart broken and you're 17 doing your HSEs? How?
That's not off topic at all.
That is what it's about.
It should be. That's what we should do.
Yeah,
But I'm saying that's good. It's
Yeah.
funny that you say it.
I think that's actually,
There's another one here.
Melissa can't turn herself on.
Just hold it down.
Sorry.
what was the question? Oh, intimacy. Look, I think intimacy is actually what sexual health is all about. Intimacy with yourself, with a partner or partners, and that will change, throughout life. I think that learning how to deal with difficult feelings starts when you're a child, when you're a baby, and you usually get that soothing and that comfort from your parents, and you learn to talk, or your parents talk to you about, maybe getting teased in the playground, or if you fall over and hurt yourself. So you're learning some of those skills already from your parents. What changes when you enter into your first sort of intimate sexual relationship with another person your age as a maybe a high school student is that it's not the sort of thing that you want to talk to your parents about necessarily. But you already have some social skills talking to your friends, your besties, your mates. You already have some practice with how to be intimate, how to share your secrets, how to talk about your feelings. And it's really just, I guess, it's an extension of that in a way. I always encourage young people to try and understand their own feelings first. So if you've had your heart broken, just dwell with that with yourself for a little while and kind of work out what it is you're actually feeling. Why do you feel heartbroken? What are the feelings that you feel around that? And then you can write them down. Not for the whole world to see. And from there, you talk to someone that you trust, and that might be a parent, that might be your best friend, and you go from there. It's something that you learn to do with practice, and I think that life, is not all about being constantly happy and joyful. It's also about allowing yourself to feel sad and disappointed at times.
So much wisdom. Sahaj, who would you go to if you want to talk about becoming a competent lover? Do you? Would you go
Jack,
to your?
I'd come to you.
Me. Oh. Well, that next question. Do you want to?
No, I was joking. I wouldn't actually come to you.
Oh well, that's ruined my day.
I'm not really sure. I mean, I know a lot of young people take the find it out as you go along path. And I think that's probably what I would do too.
Don't we girls know it? I'd say it's time to ask people questions. It's okay to actually. Yeah, sorry, jump in.
I think that's a really, that's a really important question. And yeah, look, there's all so much stuff out there that you can read and learn. I think go to the person you're having sex with. If you can't have those conversations and chat about what works for you, what works for me, what are we going to do, what should we try, go to the person you're with and work it out in that space that you're creating. And if you can't do it, I don't know, maybe I'm just like, you shouldn't be having sex with the person you can't talk about having sex with them about, you know?
That's right. Did you want to...
I just wanted to add that that's so important because you have to navigate the issue of consent. And that's very difficult to do if you're not talking about it.
Yeah. That's true. And that was the other thing, actually, I think you said too before, Tracy, off mic, was about making sure when you do have a heartbreak that you don't get straight on Facebook and start pouring your emotions, because it's a very vulnerable feeling. Oh, who's had their heart broken? Come on. Come on, who's been smashed emotionally? Oh my God. That feeling the first time isn't it amazing? Like did you get it twice? It's gorgeous thing. But it's really terrible. And I say, and you've got to cry, because it's hard to believe that you cannot be loved. Like, isn't that true? I couldn't believe it. When my boyfriend, when I was 15, said he didn't love me, I thought, oh, you'll snap out of it. Of course you love me. Everyone loves me. And my advice is when you cry, because you'll fall on the floor into fetal position and you will weep from your deepest place, don't do it on the carpet, do it on the tiles, because it's cold and you get up fast. Hey? That's how you build resilience. So I just wanted to ask one question, Jack. Sorry, one thing. I just would like to make a proposal that today we make a pact and we grow our pubes back. What do you reckon? Like a pube pact. Yeah, come on. Starting today. Got any takers? No, didn't think so. All right, I've already started.
If you'd like to hear more about Mandy Nolan's boyfriends from the past, you can buy her new book out now. I'm not sure what the title is exactly, but...
Oh, my book. Oh, I should have bought you one. It was about all the boyfriends I'd had.
Oh, really?
All right.
Do we have time for...
I'm ready to ask this a question from there first.
Is there a question in the audience? Yeah, yes. There's a microphone coming to you.
I want to address the question of the grey area or misinformation or mixed messages, or there's actual ambiguities. So we've heard about the legal position of, under 18, and then the medical position of any student, anyone can access medical information. But I'm not sure if you're aware of the Department of Education one. So there's you can have all these pamphlets in schools. Okay, I work in a school part-time, that where students can get information about accessing medical information. And I'm talking specifically here about the emergency contraception or the morning after pill. But we, as Department of Education employees, are not allowed to assist someone to get that. And I actually fell into a black hole in that one because I gave a student a lift into town because of the window of opportunity of emergency contraception, having a time limit, and got into trouble, basically.
Would that have also been the case if you'd driven that student to a medical appointment? Because I've had school counsellors bring students to me for their medical appointment with me, where I might give them contraception, for example. So I don't quite understand the policy.
The two parts of that could be, yes, driving a student and the student signing themselves out.
Sounds like there needs to be some discussion around those policies, because I work a lot with school counsellors, you know, and young people sort of to support them in whatever it is that they need. And I wasn't aware of that policy, and I'm not aware of what the limits to that are, but I've certainly had school counsellors transport students to see me, for example.
I was just going to say, with all the conversations I've had around the country, there are lots of people, lots of teachers and health professionals who are doing stuff without the knowledge of their organisations, schools, etc. And the concern I have with that is that I understand that sometimes that has to happen, but the concern I have is going back to the conversation we had about shame, that somehow this has to be kept a secret, that we can't kind of have these conversations, get people the care that they require. And for me, that's, again, it's a bigger conversation, but I do know that a lot of people are doing it without the support of their managers, organisations, and that puts you at risk. And we thank you for the care and however, it's tough on you personally.
I feel like probably it's a good time to thank the panellists and to thank all of you, to thank Jack. It's a real, don't forget to do your homework. Forget that, because we'll be checking. Once again, a big hand for all the panellists today. And thank you to PASH for putting sexual health and conversation about sexuality for young people on the agenda, because it's extremely important.